Well, for a variety of different reasons. Keep in mind, I came into the EMR scene way before the stimulus package. So I came at it from a much more different perspective. I was not caught up on all that, although I know that's very important to physicians and I want to take advantage of that as well. I was really looking for a way to be as efficient as possible in the office. I wanted things to be much more streamlined. I wanted much easier patient access for everybody in the office. And we were getting to the point in our office that we were spending an inordinate amount of money on transcription costs as well as mail costs. And I was trying to figure out a way where we could sort of make it more financially beneficial to our office. One of the reasons we went with Glo, and I did look at numerous other EMR systems, was what I liked about it was the fact that it was very flexible in terms of sort of meeting the needs that we wanted. Well, the nice thing about the implementation process, A, is that they were on site. Some of these other companies really wanted to do a lot of it sort of over the phone, and I just felt that that was unacceptable. I mean, we have 9 people in the office. We wanted everybody involved in this. We knew there was going to be resistance when you make change, right? And so I felt very strongly that the more they were here, the more comfortable people were going to feel if they could sit and ask the person directly. And literally, the partners sat with each person individually at their desk and have really walk them through every step of the process. I would honestly say that within a week or less, we were full bore. We were going full stream, and we haven't stopped since. It's been one of the most beneficial things that I've ever done in my practice. I have become extremely efficient. My staff has become extremely efficient. gloStream has allowed me to almost never have charts to have to dictate when I get home. I'm able to finish my work before I leave, I would say 99% of the time. One of the things that they quickly realized with gloStream within days is that the system actually made them much more efficient than they were prior to the change. And I would say now that if I went to anybody in my office and said we were going to change again, they'd probably wring my neck. When I walk into the room, we have the consultation up on the screen, and my office staff is actively engaged in entering a lot of the information. For example, past medical history, past surgical history, medications, allergies, all these things that I used to not only write down, but have to dictate if I wanted to put it in a note. All that has already been put into the system. So I can really focus on taking care of the patient. One of the beautiful things that we're seeing going forward now, 3 years out for us, is our transcription costs are non-existent. Our mailing costs are non-existent. Our stationary costs are non-existent because we were able to build into the system basically a template of our office letterhead. And when I send a letter to the physician, I can send it via email or e-fax on our letterhead built into the system. So between transcription costs, mailing costs, and paper costs, we have generated tens of thousands of dollars in savings just in the last 3 years. Patients love the fact that gloStream has allowed me to spend more time with them and spend less time writing either in a chart or on a piece of paper. And so they feel, I think they leave that consultation knowing they had the doctor's 100% attention the whole time they were in there.